So I will count us down
All right.
and we will jump into it. I'm so excited about this.
Me too.
All right. In 3, 2, 1. Hey, welcome back, everybody. Jeff Rick here, coming to you from the home studio for another episode of Work 20XX. And I'm really excited about this next episode. I saw this guest. She was giving a presentation in somebody else's webinar, and it really got some foundational issues around hospitality and what does hospitality actually means, and where's the deeper meaning, and why is it so important, and why is it when we have these really meaningful engagements with people that we really feel something different. And so I was really excited to reach out and to invite her on. So joining us through the magic of the internet, I think all the way from South Carolina, she's Michelle Ossmann, the Director of Health Research and Insight for MillerKnoll. Michelle, great to see you.
Thanks so much, Jeff. It's great to be here with you.
Absolutely. So how did you go from just a little background, hospitality and kind of social anthro people stuff, and now you're in design at MillerKnoll? How did that journey kind of come about?
Well, I was trained as a nurse practitioner. I was a nurse and NP for about 10 years.
Oh, you came at it from nursing.
I did. I was a nurse practitioner and a nurse in the emergency department and neurocritical care ICU at Emory University in Atlanta. And I happened to be the client over 20 years ago and thought, my goodness, clinical people should have formal training in design. So I applied to the School of Architecture and got into Georgia Tech and started that program. And then I interned with HKS, another big firm in town. And they said, you're an NP, we would never have you design the chases in the wall. You should get a PhD and tell us what we should do. Now, I've never told any designer to do anything, to be sure. But I've really spent my time trying to demonstrate and measure that design matters to clinical work. And that's why I was brought on to MillerKnoll to specifically work on health research. And hospitality, of course, is something that healthcare cares quite a bit about.
It's funny, the history of hospitality. Let's just get into it. And I think of Letitia and manners, and you think of the formality, but that's not really what it's about at all. It's much deeper. So I wonder if you can tell us a little bit about the history of it, and specifically doing the research, this really odd juxtaposition between someone who's a threat and then now someone who's actually an obligation, morally, ethically, religiously, whatever you think. Really, that just a slight change in a couple of letters completely changed that word.
Yeah, no, it's a fascinating notion. I, like you, like I think most of us, have thought of hospitality as something that the hotel industry owns. They talk about the Holy Trinity: food, beverage, accommodation. That is absolutely how I conceptualized it. And most healthcare institutions, and I think other businesses as well, think about it in those terms. You had the hospitality station, right? There is that person who's responsible for greeting you at the door, as if that somehow makes it happen. And I started wondering if that was really all there was to it, and started with a concept review going back to the fundamental literature, which actually comes out mostly from Europe, and found that it is actually deeply ingrained across cultures, across the world over time, as this fundamental set of values that all human beings share. And the interesting part is that, again, in continents where people have not seen others for 40,000 years, for example, the Aboriginal peoples in Australia, they have those same basic principles of welcoming the stranger, providing for their safety and security. Yes, having the food and drink, wanting to hear about who they are and share of themselves too, and the obligation that exists to bring them in, and this crossing of that boundary, bringing them in, and what space means there. So there's also this architectural spatial component there to hospitality, which I hadn't really quite realized. So yes, it's a fascinating subject to think about. How hospitality really has been about the management of strangers. You could argue that that's where it derived from, and then the implications for us in the workplace and then in healthcare.
How do you think it switched though? Because I was just talking with somebody the other day about kind of the natural kind of a birds of a feather, and in the context of kind of DE&I, and we just tend to go with things that we're familiar with because it's easy and it's a safety mechanism, and we can quickly categorize and put people in a bucket. And we were talking about, if you're around the watering hole and somebody showed up that you didn't recognize, didn't know, maybe they were dressed a little bit different. Back in the day, the first assumption would be threat. So how did that flip from being hostility, to being hospitable, and actually feeling, not only the need or the desire, but again, the obligation to actually take that person in. And I think in some of the examples I was reading, getting ready for this, even giving them the best bed in the house.
Yes.
So it's really this huge reach. What do you think kind of drove that? What are some of the foundations between that suspicion of the unknown versus the we really want to take them in?
Well, I think if we go back historically and anthropologically, it's both survival and religion, right? Hotels are a relatively modern contraption, right? So if you were off in the wilderness somewhere and you stopped, there was no other place except those who happened to take you in. So it was certainly part of that. But also, if you look at any major world religion, there is this core requirement to welcome the guest who comes to the door, because they could be an angel or a god, and you never know who they are. And so treating this stranger, you can see how it serves them to assume the best, right, of this person. But your point about the danger in bringing them in, there's this reciprocity that exists in hospitality that everyone deeply understands, which is to say, when a stranger would be invited in, yes, the host would be obligated to care for them, but the guest would be obligated not to harm them. And it's not that this was verbally spoken, it was this understood construct. I will take care of you, you will not harm me. Right. So that's how that works. Right. And that's why in literature, for example, Shakespeare used violations of hospitality when King Duncan was murdered when he was a guest in Macbeth's house as a way to highlight that treachery, because that audience would have understood as a guest, he should have been under the most protection. So I think that's how, culturally, anthropologically, we've made sense of it as humans.
Right, right. It's interesting. And the lead attribute in all this background material I was looking up is safety. And, we
Mm-hmm.
talk a lot about psychological safety on
Mm-hmm.
Work 20XX, especially in the context of encouraging people to take risks so
Mm-hmm.
that they can innovate and experiment and fail now and
Mm-hmm.
then, because,
Mm-hmm.
by rules, everything's not going to work. You talk
Right.
about psychological security,
Mm-hmm.
which is a little bit different than psychological safety, but it's at the top of all these things. So, and I never really thought about it. And I think some of your notes on the design that, you don't have an open back where someone can sneak up behind you. I mean, I
Mm-hmm.
never would really have thought of security and making people feel secure as the number one attribute of
Of hospitality.
hospitality before
I
you get to the
know.
other stuff.
Neither would have I. I mean, not till I began this work did I discover that that was the case. To your point about the psychological safety and security, again, over and over in the writings and the literature, it talks about, yes, providing for that physical safety and guaranteeing that, but also, and Henry Nouwen uses this term, creating the literal space to be exactly who you are. And that being, again, a core part of that hospitality engagement, if you will, is where you invite that other person to share their stories. We see that in Indian cultures and how they express hospitality. It's explicitly called out that way. So I think that very much makes sense. And to your point about, I hadn't thought about it until you said it just now, that in making sure that no one can walk behind me, you are providing for psychological safety in the modern workplace. Because if you can walk behind me, you can see what I'm doing on my screen. Can you not?
Right,
My
right.
privacy is being violated. You can see whether I'm searching the internet or if I'm doing my work. So there's something very interesting about the crossing behind you that, yes, it has this physical dimension, but has psychological implications.
Right. Another thing you talk about is kind of the role of the territory. Is it
Mm.
my space or your space? And we often talk about if you're in a contentious situation, it's good sometimes to meet somebody in a neutral ground. And
Mhm.
we understand what kind of neutral ground is, but you talk about this concept of almost concentric circles of host versus guest. It's not this
Mhm.
binary thing. And in the
Mhm.
context of work, where the employer potentially is the host to the employees, and then the
That's right.
employees then are the host to the other employees or to the customers or whomever.
Mhm.
When you think about that changing in that dynamic between being a host and being a guest, how
Mhm.
should the boss, employers, think about empowering their people to no longer necessarily be their guests, but really own that the hosting part of it? So because the other thing I thought is now suddenly I can't be a host unless I feel some ownership of the space, the
Yes,
physical space,
that's right.
which is not, it's not the place I go to work. Now suddenly I own it. So,
Mhm.
the investment that I'm going to make in that space and everything around is completely different if I feel some type
Mhm.
of an ownership. Really
Yeah.
important piece of management these days.
Well, you bring up a lot in those comments. So if I can start to unpack it some, in terms of feeling ownership to be a host, that's a key criteria. If we look at hosting behavior, who is the host is determined by who owns the territory. So you're certainly correct there, right? The administration, the boss, technically is the host of others. But Danny Meyer and others also talk about, in his book, Setting the Table, and some scholars also talk about that before one can demonstrate host to guests, for example, true guests, like a visitor, if you will, they must demonstrate hospitality to each other. So there is this sort of inter-organizational hosting that can take place. And to your point about, feeling like you belong, at Miller Knoll, I live in South Carolina, right? So I go into the office once a month, right? And when I'm there, yes, I have the right to go wherever I want. I'm an employee. I've been there many, many times. But am I a little bit of a guest? A little bit, right? Because I'm not there every day. And I do find that my colleagues who do go there every day, right, because they live in town, do take on that role to host me. Will remind me about something that is happening there, will help me find something if I don't quite remember because it's been a while. So you can see where the intra-hosting, if you will, between employees can also happen where there's a little bit of a shift of who is a full-time owner, if you will, what do you call it, a local, right, who really gets it, versus someone who's a little bit of a tourist, maybe a long-term tourist, right, on a nice work visa, but not quite there every single day.
Right. Which kind of brings up this other concept you talk about too, which is the greeter or the concierge. And obviously Walmart probably made the biggest news when they introduced greeters some time back. Maybe they've had them forever. I don't know. Where it is like a formal role to actually welcome you into the space. And you've talked about kind of the concierge role being taken, as you just said, by the people that are the locals that recognize that you're not there. How important is that to integrate people and make, that investment pay off better because you have someone actually there to help people understand what's available to them?
Well, I think if the general folks that are going to an office, for example, tend to be periodically there, then the role of the continuity, if you will, that's provided by that hospitality person becomes really, really important, right? Because they become responsible for knowing all the things that are collectively distributed within all the other people that come and go. So I think it really depends on the degree to which there is a consistent presence. Right, we certainly see this in healthcare even, where the doctors may come and go, but the nurses tend to be the ones that work on that unit every single day, and they, if you will, take on more of that hosting ownership role because they're there every day. So again, I think there's a time dimension to it, a comfort dimension, a density dimension to it. To really answer that question, it's a little bit case by case.
Yeah, well, it's interesting in the healthcare example, and the thing I think about is when you're in the room and the nurses or whatever coming in and out, and they knock, right? They always knock, 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 I'm coming in, knock, knock, I'm coming in. So it's almost like this, have they in the act of knocking and asking to come into to the not the waiting room, but the treatment room. Have they basically transferred ownership, to a degree to the patient by subserviently asking if they can come in? Is that
I think so. I certainly think so. And that's an active goal, I would say. In any design meeting I've ever been a part of, there's always the desire to make the patients and family feel like they can own that space and determine what happens. Granted, of course, safety being first, but after that, certainly then them taking that ownership. And it's a core nursing principle. I mean, you'll notice that nurses don't tend to mollycoddle patients because it's key that patients can do for themselves as soon as they possibly can. So it's consistent with how we would deliver care. But that knocking moment is critical for saying, you own this, may I? Right? And again, that guest-host relationship taking place there.
Right, right. So another piece, you talk about the practice of hospitality. So you got protection, which is first, and safety we've talked about. And the second one is intellectual welcome, which is a really interesting phrase. It speaks to, in the notes here, a real empathy, a real desire to hear the opinions of the other other person. And it gets back to this reciprocity. Bungling my words this morning. So can you have hospitality if you don't have that two-way exchange, or then it just becomes, if you just kind of got a one-way information flow, or you don't have really a two-way
Mhm.
appreciation of the information flow. Is that no longer
Mhm.
hospitality? Is that just, I'm getting
Well,
speech?
again, if you look at the theoretical models that explore what hospitality is, that reciprocity is required. That it can't be one way. It has to be the host opening up themselves to whatever the guest has to bring, and vice versa. Recognizing that everyone benefits. There's this mutuality that has to exist there, which again I think makes very much sense for us in the workplace and certainly in healthcare.
Right, right. Okay, so I can get this last one of these three, so I can get down my table of three, which is the table fellowship, which is the piece that
Mm,
most people put at the top, but you've actually
mm,
got it in third place, which is the
mhm,
actual sharing of a meal or the breaking of a
mhm.
bread. And you know, I gave you homework before we did this because I wanted you to watch Sean Evans. I'm a huge fan of Hot Ones, which people
Oh
that
yeah,
watch the show know, and
so
I
great.
also am a huge fan of the interview format, obviously, and the fact that I've seen him describe and I've watched the magic that comes from both sharing a meal together, as well as
Mhm.
he adds the shared pain experience as well. And also, he demonstrates care through the knowledge of the investigation of the questions. And
Mhm.
what's I think is so interesting and transformative is you watch two people who don't know each other become best of friends and
Mhm.
hugging and tearing up together because of the hot
Mhm.
sauce. In
Mhm.
20 minutes, I think it's a pretty amazing demonstration of the power of breaking bread. I wonder if you can share more
Mhm.
from kind of the research. What is it that's so special about sharing a meal
Mhm.
together?
Well, Woolley and colleagues did some of this work in 2017, and they did about 4 different experiments looking at this phenomena and found that incidental food, so being assigned food, which is exactly what he does, right? He gives them, they don't really have a choice about the hot wings. They're having the hot wings. Um, uh, Engenders trust and cooperation between strangers. And that's a phenomena that's been repeated over and over again. There is something about food as opposed to, and they test this wearing the same color shirt. We would have that in common. Now, would that get you there too? Apparently not. Something about eating the same food, even if it's assigned, does that for people. And they hypothesize it. Again, it has to do with breaking bread and this, fundamental trait of what it is to be human that does that. So there's scientific basis to why his work works.
Right, right. And then the other piece you talked about is it has to happen at the same time. There's a temporal
Mhm.
component as well. It has to happen
Contemporaneous.
concurrently.
Yeah.
Um, which is easy to understand sharing a meal, but there's two like huge trends right now that I want to get your take on that
Oh,
are really
sure.
going against the power that you're offering
Yeah.
through this hospitality. One is the increased asynchronous time that we all spend
Yeah.
together, whether that's text or email or
Right.
changing messages, right? So the amount of time that we're together is less as a
Hmm.
percentage of the total, even within a work context, right? As more and more
Hmm.
of the work moves to asynchronous. And then the other piece is digital versus atoms, right? It's electrons versus being together. And I had a really interesting conversation with someone the other day about, what does in real life mean? What are we in real life together now? Are we together now?
Good
And
philosophical
in some
question.
ways we certainly are. In some ways we certainly aren't. We can't break bread together, but I certainly see you and I see your expressions and I feel your emotions. So it's really interesting, these two things, this increasing digitization of
Mm.
engagements and interactions, and then the increasing kind of asynchronous nature of the increasing percentage. How do you see that impacting things, and how should people kind of combat that, if that's the right word, or is there a hospitality flavor where we can reduce the requirement of actual physical contact or the temporal piece, or
Yeah.
is it going to be something completely new or a derivation? What do you think?
Yeah. Well, when scholars approach this question, they argue that the temporal, the contemporaneous nature of the person to person is a key requirement for demonstrating hospitality. Now, what you described there, you and I here talking, that may just not be hospitality. That might be something else, right? Which is
Right.
okay, right? It just may not be what we deeply as humans would understand to be hospitality. Now, I think there's power in that, right? There's power in something that is so human, I cannot articulate it or explain it, but every human on the planet feels it, right? There's something about that, right? That I don't know that 50 years on computers are going to overcome millennia of evolution, right?
Right.
So there is that magic that happens when you have the in-person. And I think we all recognize that. And there's data everywhere talking about how the relationships are certainly better when you're in person. In terms of how we start to anthropomorphize technology, though, I think that's a very interesting question, right? So traditionally, researchers would suggest that it has to be human to human. People are marrying their chatbots, right? They're marrying their. I know I heard this crazy podcast with this woman who married him. People, if you ask them, does those who get counseling, for example, will imagine that the AI interface has a favorite color, has a gender, right? So as humans, as we decide and we anthropomorphize technology and robots, is that enough? It might be. I don't know if the robot brings me something. Am I experiencing hospitality? I think these are more contemporary notions that we have to think about. Just because they're not historical and they're not anthropological
Right,
doesn't mean
right,
wrong. It's just a new way of looking at it. So I
right.
think that question is still open, right? As we encounter this new digital world. But again, I'm not sure that can overpower millennia of a contract that we all deeply understand and feel as human beings.
Yeah. No, and I don't know if it's a replacement or substitute. I just wonder if how it gets integrated in, right? If you're a digital native in the way that you interact, you didn't get
Mhm.
Letitia Baldridge's book from your grandma on the right way to set the table, and you didn't
Right.
follow, kind of formal rules and ways, and you're used to communicating, say, in more of a digital format that is usually more async. Will some of the attributes that have come from that, deep in our brain, socialization, can those be achieved via, or portions of them be achieved via some of these digital means or some of these alternative means?
Well, I suppose I have a question for you. Do you think digital natives, I think about, my college age children, digital natives, are you then supposing that they prefer digital non-in-person contact first?
No, no, not at all. And again, it's not a prioritization of digital over
Mm,
physical in terms of which is better, but it's more just that digital is an increasing percentage of the total time in our
mm,
relationships.
mm,
So
mm,
can some of that goodness of the physical, come across in the digital? And I do think that there's a lot more intimate connection available in digital than most people would think who haven't
mm,
experienced it. And
mhm.
my favorite stat there is from a Stanford study, which is when I met my spouse in like 1985. There was no internet, there was no online dating. It wasn't
Right.
an option, right? So the choices were at work, your friends, church, social, blah blah blah. There's like
Mhm,
10 choices on the
mhm.
study. Now, online dating represents over 50% of new marriages.
Wow.
They
Wow, that's
met
great.
on online dating.
Can't
So to
imagine.
me, with that, is just a slap in the face in terms of the context of like return to office and work and communications, is that
Yeah.
younger people can reach a level of intimacy via
Mm,
an online application that didn't even exist when I was in that frame of mind. So how can I possibly kind of really understand that? And I think that's a really illustrative thing that if you're comfortable with the technology, there is a level of intimacy that you
mhm,
can get via digital means that
mhm.
maybe those of us that didn't grow up that way don't necessarily appreciate. And the people marrying their bots is another. I mean, that's kind of a twisted example because that's also the anthropomorphication. I always forget the extra syllable of the technology, which is a whole
Right.
different kettle of fish. But I do think, right, the digital tools are here, and it's just interesting how those get incorporated, um, in a positive way to provide the warmth and provide the connection and provide the kind of support that we're trying to do as organizations.
Yeah. I suppose I wonder when I think about young people, is that those who are in college or those who are out in the workforce? Because those I'm finding in college, they want internships that are in person. They
Right,
don't want that remote internship. I'm finding that they aren't bringing phones to parties anymore. They're actually trying to buy cameras and actually use cameras because the phone implies I'm not here with you. I can
right,
still capture everything, but I'm doing it with a camera so that we're here together.
right.
I do wonder if there's going to be this pushback, if you will,
Yeah.
to recognizing that there is something valuable about the in-person. And, as far as people meeting online, yes, that's true, but they eventually come together in person,
Oh,
right?
oh, for sure.
Right?
No, and
They
again,
do.
it's
They
not
do. So eventually, right? I
Yeah,
mean,
yeah, yeah.
I think the digital can be great for starting, for continuity, but there is still a requirement, I think, for the in-person if you really wish to spend time and know someone. Simply for all the in-between moments. In design and architecture, we spend so much time thinking about the rooms, but not the corridors.
Mm,
And so much happens in those corridors. And so I wonder, in that same sort of way, what is the corridor of human interaction if it's only digital, right? There's the I get up and I move around. There's all sorts of things that you would never know about me just seeing me like this.
right,
And
right.
so, I do think that there's something special there. And perhaps technology will be such that it does come with me in the corridor at some point, and I'll buy
Yeah, yeah. And again, I don't think it's
the
a
Apple
substitute for.
Glass.
I just think it's an increasingly important piece.
It is.
I think that's the piece that we have to kind of appreciate. And in the context of remote work, and the context of hybrid work, and the context of distributed teams, it's an important piece, and um, an increasingly percentage of your engagement, right? It's just your actual interactions, of your actual behaviors, are just
Oh,
more and more and
certainly.
more digital,
Of
and
course.
asynchronous.
I'm a remote worker, right? So,
Right.
I go in periodically, and that's always been the case for me. I really wish someone would do a study where they would check engagements scores like the day after someone comes to the office. I bet you that I have a suspicion they would be significantly
Oh,
higher.
for sure.
You
Well,
know,
Brian Elliott, he likes to say, distributed is not never together.
it's
And
true.
I just had Don Price on from Atlassian, and they get together like 4 times a year, his team.
Mm,
So no, you definitely got to get together. But let's shift gears a little bit in the context of work and workplace. So you specialize in design and trying to think about the design things that are going to make a difference. But I'm also thinking in terms of these mandates that we're hearing, and just
mm,
that is not a host inviting their guests back,
no.
and it's certainly not a host who's trying to encourage his people to take ownership so that they can be the hosts
Hmm.
and own it. It's
Hmm.
so contrary to all the things that you talk about. So how should people approach getting people back to the office and getting
Yeah.
back together from a more traditional kind of host and guest point of view?
Yeah. I love how Danny Meyer puts this. He talks about treating all his employees as if they're volunteers, because they have choices,
Right.
right? And so I think if you approach your workforce as a set of volunteers who decide to spend their time with you and give you a portion of their lives, I think it changes a little bit of your perspective. And of course, when we think about volunteerism, we often have much more joy in our work when we're choosing to do it, right? So there is the responsibility, I think, on the behalf of the staff, of the worker, to imagine, all right, I'm choosing to give my time here. How best might I do that? Sometimes it might be best for me to work from home so that I can pick up my son from school, and my employer would care about that, right? So there is this flexibility notion, but I know it's challenging to then go to an office and nobody's there, right? So
Right.
that's terrible too, and that's where I wonder how technology is going to help us start to orchestrate some of that a little bit better. I've been a remote worker for 10 years, and so whenever I would go into the office, I have a schedule. I know who's going to be there because I make appointments with them, right? And so you can see how that can work, but it takes more effort, right? I think going to the office every single day and everybody doing that, you don't have to work so hard. It's easy, right? Because everyone's going to be there. So there takes more forethought, more planning. And again, I'm not sure that's a bad thing if we are more intentional with our time. How
Right.
many articles do we read about being more mindful and intentional with our time and doing things with purpose? Perhaps we can start to approach this as an opportunity to go into the office with purpose rather
Right.
than just
Right.
showing up because you have to.
Right.
But the
Well,
mandates are tricky. You
on
know?
site's the new offsite, right? That's what
Yes.
they say. Well, because of the intentionality, right? And you've got
Yes.
an agenda. When you go to Michigan, you've got people you want to see and things you want to get
Hmm.
accomplished, and why you're
Precisely.
making the trip. So why not do that every day? There was another part in I think a lot of it in terms of like restaurants versus eating at home, and working at the office versus working at home. And why do people go to restaurants? They go to restaurants for an experience that they can't get at home, even if they can cook the meal. And there's a real opportunity, I think, in offices and in space, and you've been very involved to create things that aren't available at home, to create different experiences. But you've made an interesting comment that no, Jeff, you're wrong. It's not really the experiences, It's really the relationship. It's about finding relationship and building relationship within the experience. The experience is almost like an overlay or an excuse, if you will.
Well, I don't know that you can detach the two, right? I'm a scholar of environmental psychology, so I don't believe that you can pull the being out of the environment that they are in. So I look at those as inextricably linked, right? So within the experience, relationship happens. I don't know that you can, pull them apart. I do think though that there is a requirement now that we make coming in superlative. We talk about this in healthcare, right? For example, so much of what we do can happen in your home, right? So then when you come to the office, there has to be something really special that you're there for. Otherwise, why, right? So perhaps that's just coming to the office in the same way that it's been that way for healthcare for quite some time, that there is this obligation to make it something special, something I cannot do otherwise, right? And I think organizations could even have rules around this. Certain things should only be done in person. We do that in healthcare, in part because of the physicality, right? You
Right.
can't get something out of someone's ear necessarily remotely, right? Unless you're especially skilled. But that same sort of rules, I wonder about that, rather than allowing folks to settle for second best, recognize when you need to convert and come in. We talk about that. It's called conversion in healthcare. You have to convert from the video visit and come in, because something has happened that means that we can no longer do this well, safely with you at home. What is that for workplace, right? That we can no longer do this well to the benefit of the organization, the benefit of the person, that they come in for that purpose. And the restaurant example, I think, is a nice one. We use that in healthcare too. But going to the hospital or going to the office, I don't know that it's like a restaurant. I don't get cocktails. I guess you do now in offices, but sometimes. But you don't have that sort of social imbibing that happens at a restaurant. There's a bit of an obligation there, right? A desire to perform. It doesn't quite exist in a workplace or in healthcare, where it's a sort of work associated thing. So I think considering that notion as what should and could happen are two very different things.
Yeah, unfortunately, we see that over and over. So, I mean, what would your advice be then in terms of an approach for back to office if someone is struggling as a senior manager? And healthcare is a little bit different because there's just some things you have to be in, but just
Mhm.
kind of in general from a leadership perspective, using the concepts of hospitality and thinking through of host and guest, what should be the tone? What are some of the messages? What is the way you structure your even though you talk about kind of what's your real motivation, even if your real motivation is just to get people back, how would you structure that conversation to help people see it as you're being invited back as a guest, or I'm
Right.
inviting you back because I want you to be the host and and be proud
Mhm.
of the space, as opposed to come in now. We're
Right.
watching your bed swipes or your
Right, right,
keystrokes or
right,
whatever.
right, right. Well, again, because hospitality is relationship based, there has to be this in-person component. I think it needs to be replicated by the leadership. If they want you there, they need to be there to welcome you, right? Because that's required. You have to be in the space if we're really thinking about hospitality in its fundamental terms. And then I think being careful about the curation and making it an open place where you feel like you can be yourself. That may mean that it's okay to leave at 3 o'clock for an appointment because I'm being who I am without fear of retribution. There's a culture and a space thing there that move together, where I think hospitality can set the tone and can be a bit of a blueprint, if you will, for, are we meeting these criteria? And if we're violating one, right? If you have to be in your desk, well, then I'm not really meeting you where you are, am I? I'm imposing my rules upon you, and I can do that because I'm the host. I'm not really being hospitable, am I? Right. So I do think it's a nice way, a relationship based way, a human based way to think about how to encourage people to come into the office because of the benefit that's there, and recognize that there are differences. We talk about patient centered care because the whole notion is that you think about what the patient needs. And what about having worker-centered care, which is to say, yes, there is a job that needs to be done, but we will account for an individual need, right? And allow flexibility there. It's a whole lot more work to do that. right?
Right.
And I think
Right.
an organization has to be open to the work that is going to be involved, because it is a whole lot easier to say, you got to come in and I'm going to use technology to know whether you've showed up using accelerometers in the chairs. That's easy. What's hard is to really spend the time to get to know your people and be able to trust them and know what they need and want that relationship. It's a different kind of organization, right?
Right. Right. I want to get you take as a nurse and being in healthcare, because nurses have, like, I don't know, the hardest job in the world. It's certainly got to be up in the top five, if it's not one of the top. And it's a really interesting place where there's this kind of crashing between technology and high stakes engagements, and still really human. I mean, as human as it can be. And nurses are the ones that are really kind of at that intersection point. And you see kind of this influx of technology and all this change, but then you've got the design. How have you seen technology help to stop burnout, slow burnout, to make the life of the nurse much better, so that they can then provide, better care to their patients? Because, as they always say, put your own mask on first before you help the one beside you. And, nurses are busy, busy, busy people.
Well, I think you wouldn't find a single healthcare provider that would say technology has necessarily made it better, right? It's certainly arguably made it safer, right? Because we have this continuous medical record that is fantastic, and we have the monitors and what have you. But there's a lot of work on the fatigue associated with constantly hearing beeps and, not being able to rely on this natural perceptual apparatus we have on our bodies called eyes and ears, right? That allow you to naturally appreciate what's happening around you. So technology is both a burden and a gift, I think, in that case. For burnout, I'm doing work right now with Dr. Deborah Wingler at HKS, and we're exploring burnout in nurses and adding or going back to a different conceptual model for burnout, which includes fatigue. Christina Maslach's method of viewing burnout doesn't include this physicality to it. And right, when you're tired because you haven't slept and you're hungry and you've been walking a whole lot, you don't have a lot of emotional wherewithal to deal with what have you, right? Which is the component of burnout. So we're trying to explore what are those other dimensions of burnout that are there. And for nurses, certainly there's this physicality component that exists there. And I would imagine that also exists for workers of all kinds, right? Offices or anywhere. If you're tired, if you're hungry, I mean, the reason why memes like that exist are because they are true, right? So, there is this need to care for the body that we have. We are not floating around creatures without this biological component there that has this need. So I think the burnout question is challenging with technology, and there is movement within the industry to try to decrease the number of beeps and to make the technology less obvious, because it does create another distraction, right. In the room. Because what the patient really wants, and we know that patient satisfaction is linked primarily to the quality of the conversation with the nurses. It's not technology, it's not doctors even, it's nurses.
Right.
So,
Right.
and the face-to-face, right? Because it has to be face-to-face. So I do think, again, that comes down to who we are as human beings, desiring the face-to-face, that someone sat with you, listened to you, helped you. Workplace,
That's great.
healthcare, anywhere.
So we're getting to the end of our time. I just wanted you to share, from a design perspective, the impacts that design can have for people that aren't quite sure and don't really understand it. Both conscious design elements, as well as unconscious design elements. I was talking to somebody the other day talking about sound and soundscapes, and you talk about scapes, different type of scapes, landscapes, the different rooms, and how design can really have a positive impact. And maybe a couple of examples where you can make a difference through intentional design and intentional setups to make the workplace a better place.
Oh, certainly. I mean, there's those ones we're all familiar with, right? Natural light, temperature, the overall service-scape, if you will, I think is the term that's
Service-scape,
often
that's it.
used. Yes, yes. There's a lot of evidence and research behind that. I'm a big supporter of where it exists, using research to demonstrate and back up whatever you're doing from design. But aside from the service-scape components, there's a lot that, again, goes back to who we are as humans. And a basic one is access and exposure, right? Being able to stand on the mountain and survey who's out there who could potentially get you, and not having anyone behind you, right? Those are very basic concepts but serve veterans who were taught never to allow someone to move behind you. So you would never put seating on an open corridor, or as we talked earlier, having your screen be to the corridor. We were doing some observations some time ago. The administration could not figure out why no one would use this particular glassed-in spot. Well, because your screen was facing the corridor, everyone could see what you were doing when you were walking past. So some things are very much about privacy, about what we call architectural privacy, which is the visual, the acoustic, what have you, informational. And we can design for things like that. We can use something called space syntax, which essentially tessellates a floor plan and allows us to use graph theory to measure the likelihood of finding other people, seeing and being seen. That can all be done with a 2D floor plan, and you can start to anticipate what your layout is going to provide for you. Again, all very science-based. So I just think that, yes, design can be delightful. And there is this, intuitive sense of beauty that we should bring to design. But there's also a great deal of science behind what we do in design that can make a demonstrable difference in the outcomes we're looking for in the workplace. We just have to work with people who know how to measure, right? I do think that badge swipes are, the basest of ways that we can measure success. There are other more complex ways that I think might get closer to what we're looking for, right?
When you walk into a space and it feels good, is that tied to something else? Is there functional, concrete things that generally correlate to the feeling of it feels like a great space? I'm not quite sure why, but this feels like either a warm space, an inviting space, a comforting space. Does that correlate one-to-one, or is there some, obviously not causal, but correlative relationship between that?
Yeah. I hate to say that so often it is individual to the person, but yes, I mean, generally speaking, being able to see what is available to you, having what we would call an intelligible building layout, so that the building naturally communicates, this is the way to main things, right, on the way. I mean, you can make layouts that are like rabbit holes and you will never find your way in or out. And casinos are like that, right? And they do that on purpose. If you want to talk about science and building design, look at a casino. That is exactly how they are created, right? So I do think that there are ways. Now, there is this wonderful notion called ambient belonging. It comes out of Stanford, where they were looking at students and whether or not they wanted to be part of a computer science academic program. And they had two different layouts. One that was overtly masculine, and you can disagree with what they chose to be overtly masculine, but things like Star Wars, and my girls would be offended by that because girls can like Guardians of the Galaxy too and Star Wars too, but overtly masculine and ones that were more neutral. And overall, the girls chose to be in the computer program that was not overtly masculine. And the whole notion there, I'm simplifying the story, but the whole notion there was that the more neutral environment communicated to them, there are others like me here. They didn't see anybody else. This isn't having women walking around, women faculty, nothing that. This is the environment communicating there are others like me here. And so I do wonder when we think about pattern and color, which is very cultural, when we think about affordances, like whether or not there's a chair that can hold me or one I can get up from easily, or a height that works for me, right? Is it communicating this is made for me? The belonging part, I think, is a big part there. And we're starting to develop measures for that. It's very much the science in its infancy, at its beginning, but definitely there is something there, right? You walk in and you're like, huh, I can be at home here, right? And I think we're working on the science behind that.
Awesome. Well, Michelle, what a treat. Thank you for spending some time with me today. It's such an interesting concept, and I think it's so powerful because, we're emotional beings. These are the deep-seated things deep in the brain that you don't take a lot of conscious effort to think about. But like you said, they've been in there cooking for thousands and millions and generations and generations of people developing. So love to tap into that.
Oh yeah, no, they are. Jacques Derrida in 2002 said that culture is hospitality itself, right? That there is no culture without a culture of hospitality, right? It is who we are as humans. And I think if we remember that, then I think it sets the tone for everything else we create. You could argue, if that's true, that everything should be based on hospitality, especially in the workplace.
Interesting challenge for the leadership going forward. All right. Well, I think we'll leave it there. We'll leave that big challenge for them. Michelle, thank you again for spending the time. We'll continue to follow your work online and really appreciate it.
Thank you, Jeff. Likewise. I love seeing what you put out there. Super interesting always.
Thanks a lot.
Mhm.
All right. Well, she's Michelle. I'm Jeff. You're watching Work 20XX. Thanks for watching. Thanks for listening on the podcast. We'll see you next time. Take care. That was great, Michelle.
Oh my gosh. Anyway, you asked very good questions.
Thank you.